Welcome to the fifth session of the National Commission to Address Racism in Nursing's fifth ECHO series. This series has a focus on health equity. Whether you have been involved in previous ECHO sessions or are new to this space, we are so excited that you can join us today and hope that this interactive learning series is a place for you to find guidance and support. This program is brought to you by the National Commission to Address Racism in Nursing, a multi-organizational collaborative of leading nursing organizations examining the issue of racism within nursing and motivating all nurses to confront systemic racism. This is an 8-part series. You will earn 1.5 continuing nursing education units for attending today's session. Please stay to the end to complete your evaluation and receive the CNE certificate. Today's topic is erecting systemic barriers for Black and African Americans from slavery to present day. What should nurses do? Before we go over our ground rules, we wanted to quickly orient you to some of the features of the new iECHO platform that we're using. First, you can review session materials within your iECHO account in the content section outlined in green, and that's within each session. Presenters will upload their slides and any other relevant materials here for your use. There is a conversations tab found within the discussions tab, circled in yellow. This is meant to be a place where you can engage with other participants in the series. Please note any questions directed to ANA staff and/or anything time-sensitive should be sent via email to commissiononracism@ana.org. If you are having trouble finding any of these features, please also email us at commissiononracism@ana.org. We also wanted to note that we have had an exciting response to this ECHO series. As a result, we have had larger than normal breakout groups. Please bear with us. We have incredible volunteer breakout group facilitators that will facilitate the breakout discussions. Please use the raise hand feature to be recognized. Keep your comments concise or place your comment in the chat to be part of the discussion. This will lead to a positive experience for all participants. Please pay special attention to our ground rules as we learn and engage with each other today. Note that we will be turning off the chat feature during the didactic portion of today's session, but you will still be able to message a co-host directly if needed. This is a brave space, and discussing racism and health equity is difficult and uncomfortable, especially for those directly impacted. Discussions such as these can serve as a trigger. Please take care of yourself. We ask that you maintain respect for everyone joining us today. Please stay on mute until it is your turn to speak. Create intentional pauses as you engage in discussion. Listen intently and respond thoughtfully. Be present. Limit background distractions and multitasking. Please take advantage of the virtual features available via Zoom. We encourage turning your cameras on and using the chat box or the raise your hand features to communicate with the group, but please remember to mute your microphone when others are speaking. Please respect participant privacy. Do not disclose names or other sensitive information shared. If you share a scenario involving a patient, please do not provide any PHI during today's call or any of the ECHO sessions. Feel free to send a direct message to ANA ECHO if you have technical problems during today's call. So now I'm going to turn this presentation over to Dr. Roy Thompson. Welcome, Dr. Thompson.
Thank you so much. Let me share my screen to share. Is this okay?
Yes, we can see.
Okay. So hi everyone. Great to be here, and I thank the commission for inviting me to give this presentation titled Erecting Systemic Barriers for Black and African Americans from Slavery to Present Day. What should nurses do? I think this conversation is very important. Oftentimes we get a lot of pushback from individuals who say, why is everything about race? Why do we have to talk about race? It's difficult to talk about race. But as someone who is Black and who is an immigrant, I can tell you it's even more difficult to experience racism. So the objectives are to really take you through a very quick historical understanding of how racism emerged in the US and the impact it had on Black and African Americans. And as nurses being the largest group of healthcare workers, what can we do to address the issue of racism? So I oftentimes start with a positionality statement. These are my identities. I identify as Black, immigrant. I'm from a working class family in Jamaica. I'm able-bodied. I'm cisgender males, and I say that because this impacts the way in which I interpret the information that I get from the world, how I am treated by the world, and how I make sense of the world. Professionally, I self-identify as a health services researcher, and most of my work is in the context of long-term care. I look at the impact of immigrant nurses on US long-term care health systems, and I use all the research designs to answer questions about the nursing workforce. So just to get so that we're clear about what we're talking about, when we're talking about systemic racism, we are talking about a system or a process of stratification where those who self-identify as white or from European descent, they benefit from a set of laws and policies and attitudes. Oftentimes when we think of, racism, persons persons think of it as just one individual treating the other individual badly. But no, what happens when your biases are backed by systems of power? When we talk about equity, we're really talking about meeting people where they're at and giving individuals what they need to be on equal footing with those who have. And as nurses, we tend to do that, right? The patients that need the most care, oftentimes they require the most attention. They're closest to the nurses station compared to those who are more self-caring and ambulance. So at different levels, we try to be equitable. But there are laws and policies that need to be implemented to ensure that everybody is on an equal footing. And when we talk about health disparities, we're talking about differences in health outcomes that are related to socioeconomic factors, environmental disadvantages. Now, the research shows that they've not been able to disaggregate your health outcomes from the amount of money you make, right? And so those who tend to have more oftentimes have better health outcomes because they have better access to better resources, right? And we're having this conversation in the US context where there is rollback on women's rights, there is rollback on voting rights. We see that there is this ban on books, and there is also the history of, state violence where a lot of Black men, women, transgender individuals have lost their lives to the police at the hands of state violence. So just to give you a short historical perspective on race, so we're going to go from slavery, come to the Jim Crow era to talk about the present day, how Black and African Americans have been treated in the US. And when we're talking about race and ethnicity, the race is a social construct, right? These are not biological concepts. They are socially constructed and they change over time. And race has different meanings across different countries and across different contexts. So there's no biological basis for race, and we're all equally human. So the term race really emerged during the 17th century at the beginning of slavery, and it was a way to separate individuals who were,
Hi, Mr. Turkis. Can
Europeans,
you hear me?
Africans, and Native Americans, right? But the use of the term race began to be implemented in the laws and policies in the United States. And that is how they were able to subjugate individuals who were Black and or African Americans. They were able to subject them into slavery because, according to the law, Black and African Americans were not considered humans, they were considered chattel, right? So, and later on, we see that the race now started to evolve. So persons were no longer African Americans or Native Americans, rather Africans or Native Americans. They were now considered Indian, Black, or white. And again, closer moving into the 18th century, we saw that race began to appear in the written law, and it started being used as a way to take away persons' rights and to grant individual rights. But during the time of slavery, there was something going on there in the Caribbean. We had the Haitian Revolution, where Africans who were enslaved in Haiti really pushed back against the slavery that they encountered as a result of France, right? And one of and their slogan during their fight for emancipation was liberté, égalité, fraternité. So liberty, equality, and fraternity. So while slavery was taking place in the US, there was this fight to end slavery in Haiti. And the Haitian folks were very, very successful in winning their slavery against France. So what happened during the period of slavery? Black Black individuals who were enslaved, there were a lot of contagious diseases like yellow fever, tuberculosis, um, and those who were enslaved were considered less intelligent, they were considered less human. Doctors tend to wanted to compare the skulls of individuals who were Black and individuals who were white, to say that there is a difference because of the shape of the skull, right? Black women, particularly, were subjected to a lot of horrors from medical doctors, right? They were operated on without anesthesia. And as a matter of fact, anesthesia was perfected on Black women, right? So they would, what they would do would have, these doctors would have, white doctors would have other Black enslaved women hold down other Black women for them to lacerate and to do surgeries on them. Beating the enslaved was considered a form of medicine. Slaves who tried to, run away, they were whipped because they were, being lazy, and being whipped was considered medicine for being lazy. And it's important to note too that Black folks have never, or Black and African Americans have never accepted slavery and have never, ever, ever accepted their subjugation. All right. Physicians used to purchase slaves, and physicians from very prominent universities, what they would do to male slaves as well, they would castrate them, right? They would cut off the testicles if the male slave had like an ulcer compared to a white counterpart. They would just amputate the limb of the enslaved Black man. And women were, delivered babies in very, very harsh conditions. Sometimes too, in New York, slavery was, there was slavery was rampant as well up north. And what they would do, they would capture some enslaved persons and put them in these cages and charge like a lot of money for people to come and look. And they would lie and say, "Oh, look at this enslaved person. He's like 200 years old." Right? Which is a lie. So Black people were not considered fully human. So then at the end of the Civil War, legally, slavery ended in the United States, right? So things should improve, right? Wrong. So this ushered into the Jim Crow era, right? And the laws actually started to change again, where white individuals were allowed to maintain their economic power, and Black individuals, they lost their property, and there was a lot of violence and lynchings that were meted out to individuals who were Black. Their properties were stolen, they were chased out of towns, they were hung, and so it one way, individuals who were white maintained power was through a lot of systemic violence. Persons who were just seen walking around the street were considered, I can't remember the term, but they would lock them up, right? Because they need to work. They're just wasting time, right? So you really had very, very, very little freedom. And those who were Native Americans too, they lost their lands, right? And they were pushed to the margins of society. But then the classification of race during Jim Crow also started to change. So not everyone was considered white, right? Persons were categorized based on your country of origins. So at the time, Italians were not considered white. People who were Irish were not considered white. But then over time, they were reclassified as white. And this was done as a way to maintain, racial power. Now, Emmett Till's lynching is very, very, very painful, but one that we must not forget. So Emmett Till is this young 14-year-old, I think he was 14-year-old gentleman, a boy who visited his family in Mississippi, and um, he was lynched because he went to a shop and he whistled at this, white lady, Carolyn Bryant. Her husband and her brother-in-law, they came in the night and they took him, they beat him. And in the middle here, that's the face of Emmett Till. They beat him. They shot out one of his eyes, so you could see through his entire skull. And then they put a cotton gin around his neck, and they threw him in the Tallahatchie River, and he was found, 2 days later. And they wanted to cover it up and have a closed casket funeral. But his mother was like, no, we're not going to have a closed casket funeral. I want the world to see what they did, to my son. And so what this really galvanized a lot of the civil rights protests during that time. In the 40s, too, people who were of Japanese descent were also placed in internment camps during the Jim Crow era because of the Pearl Harbor bombing, where Japan bombed Pearl Harbor. And so people in California who were of Japanese descent, they were placed in these internment camps and for a couple of years. And when they were released, right, they no longer had the property that they had amassed, right? Also, during the period of Jim Crow, we had a lot of Mississippi appendectomies, new eugenics, right? And Mississippi appendectomies, a lot of Black women, they were tricked into being told that they're going to be doing um appendectomies, but what they were doing were taking out the uterus of Black women because they didn't want Black women to have kids. They didn't want poor women to have kids, right? They were trying to create this master race. So women who were considered, indigent or Black or poor, they were marketed nor planned as a way to prevent them from getting pregnant, right? During the period of Jim Crow era as well, Black folks, they were subjected to a lot of X-ray radiation, and that's what's called the nuclear winter. And a lot of these, individuals died from cancers, and their families were not compensated. During Hamburg's prison as well, a lot of the Black men in this prison in Pennsylvania, they were treated as research subjects. So what the doctors would do would go and plant fungus on their skin and kind of wrap it to allow the fungus to proliferate. And they would test out these medications on the skin to see how best they work. A lot of medical schools too would procure Black bodies that they would use to teach medical students anatomy and physiology. They never would use white bodies. And what they would also do was to raid the cemeteries. So a lot of Black cemeteries, because Black folks weren't allowed to be buried with white folks. So they would raid a lot of the Black cemeteries and take the Black bodies and then for to teach anatomy and physiology to the white students. And most persons know about the Tuskegee experiment where they targeted Black farmers. They were, infected with syphilis and they were not treated because the doctors wanted to see the natural progression of the disease. So even when penicillin came out, they were not given treatment. And they tricked nurse. There was a black nurse that they used to help with recruitment, right? Nurse Unice, and a lot of these doctors who and researchers who partook in this act, they were not, they were not brought to justice. All right. Some of the contemporary challenges we have now are mass incarceration. You have more black folks in prisons now than there were slaves alive at the time. So many have argued that the prison industrial complex is really just a contemporary form of racism. What they also find is that the states that have the most lynching are the states that have the most death penalty convictions, which disproportionately impact Black and Hispanic individuals. Now, to talk about some of the ways in which the nursing workforce can respond to some of these challenges, I'm going to propose using the socio-ecological model. And it's a way to think about how different factors at different levels may interact to cause health disparities, right? And so we're moving from the individual up to societal level. But to talk about the nursing response, I'll quickly go through some of the social determinants of health and think about social determinants of health as, so those factors that interact based on where people live, work, where they worship, where they go to school. So in the US, there's a lot of systemic racism in the housing market. They literally had drew red lines on maps, and so bank would not give loans to Black families in order for those communities to get the resources that they need. There was a lot of environmental racism where Black folks were had houses in land on lands that were polluted or near to or closer to factories. When Black families moved into neighborhoods that were predominantly white, the white families moved up into the suburbs. And we're seeing the effects of that today. If you're Black, you're most likely to live in communities that have very frequent interactions with the police. Black communities are over-policed, right? Most policemen are white, most judges are white. Um, and because of being left out of the housing market too, it was difficult for Black families to go up into the middle class or to build, generational wealth. If you are Black, or you're more likely to go to schools that are less funded. Less funded, you don't have the best teachers, you don't have all the resources that you need compared to schools that are more well resourced, especially private schools. There's also a lot of implicit bias in the context of healthcare among doctors and nurses. There is a lot of mistrust between Black and African Americans and the healthcare system. And you can see that from the time of slavery when they were being experimented on to present day. A lot of that mistrust still lives. If you're Black or African American, you're less likely to be insured. So you have less access to healthcare, right? Some of the current disparities we're seeing now, and the disparities to me were not surprising. If you are Black, you are more likely to die from COVID-19, right? Black women have higher percentage of hypertensive, crises or preterm births compared to their white counterparts. Um, Infant mortality is also worse with Black or Alaskan Native populations relative to their white counterparts. The same disparities we see when it comes to HIV and AIDS. As a matter of fact, of the women who have HIV in the United States, 70% of them are Black, right? There are nursing workforce challenges because, the population is aging and the nursing workforce is not growing at the same rate to kind of match these growth rates that we're seeing, right? Um, the workforce is also aging. About half the nurses are over 50 years and they're going to be retiring soon. Faculties limit admissions because they don't have enough faculty, and there is turnover. among nurses. Nurses are stressed out. A lot of nurses left the workforce during COVID-19 too, because it was literally like a battlefield. So let me talk about bias among healthcare workers and nurses for a little bit. The thing about we all have biases, right? We have explicit biases that we are aware of, but most of our biases are implicit. So we're not conscious of them. But the thing about it is once you recognize them, these biases can be changed. And this is borne out in the literature. They found that, white health professionals typically have, higher biases compared to their Black counterparts. And Black clients are more likely to have negative opinions of healthcare workers compared to their white counterparts. And studies after studies consistently show that biases have impacted healthcare workers and how they treat Black and African Americans. So what can nurses do? Which is really the crux of the matter. So and I'm going to talk about it at three levels. Um, so these are some of the roles of our nurses. We're the largest group of healthcare workers, and as such, we can have better, we are key players in health promotion, advocating for better access. For people belonging to racial and ethnic minoritized groups, evaluating some of the social factors and advocating to address some of the social determinants of health. So what can we do as individuals? I won't go through everything, but we have to practice radical self-care. This work is hard. You have to take care of yourselves. Get manicures, get pedicures, go for a walk, refresh yourself, spend time with family, because to really do this work, it takes a lot of time and energy. And nurses, there's a high level of burnout among nurses. We do have to read, increase our ethnocentric knowledge. We have to read up on our histories. We have to read those books that are being banned. We have to engage personally in anti-racist training, anti-bias training. I do that a lot. Whenever you hear a talk being given, show up, right? And learn as much. Be aware of the differences of how individuals identify. If you're not sure, say to somebody, what is your heritage? Instead of assuming. If you ask individuals where they're from, they can shut down communication, especially if someone is in the US, illegally. So at the system level now, I think that everybody should have racial bias training, who works in healthcare systems, and I think it should be mandatory, right? You have to ensure equitable staffing, because in health systems that are in primarily Black neighborhoods, they have worse staffing, and so you're going to have worse health outcomes. You have to have clinical ladders that allow for racial and ethnic minoritized nurses to progress into the profession as well. Right now, the higher you go in the healthcare profession in terms of positions, the less diverse it is. That is a problem, and that needs to change, right? We need to hire more racial and ethnic diverse healthcare professionals. The research shows that healthcare workers are more likely to spend longer times with clients who look like them. There is more trust with clients who look like them. And nursing models of care delivery really should be person-centered. And models of care delivery really talks about how nursing staffing is done, how nurses are allowed to delegate, how nurses are allowed to make decisions, right? And the leadership within the healthcare systems to need to be racially and ethnically diverse. We have to, push for policies that increase access to both improve staffing and increase access to care. I see now the Obamacare, which a lot of persons fought against, it really focused a lot on valuing. So there was a lot of focus instead of money, there's a lot of focus on health outcomes, right? So hospitals are now, oftentimes they can be penalized if they're having poor healthcare outcomes, right? And we really do need to leverage, push for the expansion of Medicare and Medicaid. Medicare is for those who are, greater than 65 years, and Medicaid typically for those who are, low income. And what the research find is that a lot of our healthcare policies are driven by the opinions of white middle class Americans. So at the educational level, I do think that, all our nursing educators do need to have REI, racial equity training, creating brave spaces for nursing students to talk. We have to diversify our student bodies as well. And we have to have, onboarding sessions where we teach our students, faculty, and staff about issues around diversity, equity, and inclusion. At the institutional level, we do have to strengthen coalitions with our nursing organizations, right? And this is where I'm putting in a plug for the National Black Nurses Association, the Hispanic Nurses Association, the Asian American Nurses Association, the National Alaska Native Nurses Association, the American Indian Nurses Associations. We also need to diversify the nursing professoriate. 90% of our nursing schools, the deans are white. Most of our Black and minoritized nursing professors are at low as assistant level positions compared to their white counterparts. It's easier for white men to progress to full professorship relative to women. And we do have to support grants, research grants that address issues of racial injustice, and that promote diversity, equity, and inclusion. And right now, unfortunately, we have a lot of what you call health disparities research tourists. So these are white researchers who are now all of a sudden interested in doing health disparities research, and oftentimes they're the ones who are funded relative to, Black and minoritized, professors or researchers who are truly doing this work for the longest while. Right? So at the macro level, thankfully we have the National Commission to Address Racism in Nursing that's really doing a lot in terms of educating our workforce and pushing for, strategies to address issues of, racism. There has to be more funding at the NIH to address to fund studies that mitigate, health disparities, and incentivize research teams that are also diverse, that are being led by, folks who are Black, folks who are Hispanic, folks who are Alaska Native. We have to implement anti-racist pedagogies in school. So it's not enough just to say, okay, I'm going to put in the course description. No, your teaching strategies have to be anti-racist as well, right? And we have to be mindful of the different identities of the students in our classrooms and be culturally, sensitive. And I would say we have to find a way to incentivize our professors to engage in anti-racist behavior. A lot of professors have been promoted are some of the most problematic ones within the profession. All right. And so that's the end of my presentation. That's the didactic part of our presentation. And I'm going to very briefly read the case scenario that we're going to discuss in our small groups. So because I'm a nursing home researcher, so in a large 100-bed nursing home, some staff noticed subtle racism affecting, patient care. Black nursing home residents and their families indicated they experienced overt racism from the night duty staff. So there was verbal abuse. So staff members sometimes would use racial slurs or derogatory language towards residents of specific racial and ethnic backgrounds, directly targeting them with insults or degrading remarks during bath times. In some extreme cases, staff attempted to segregate residents based on race, either by assigning them to separate areas of the facility or treating them differently in communal spaces. Sometimes there was also physical abuse. In the most egregious situations, nursing home staff physically abuse residents based on their race, subjecting them to violence, being more aggressive in terms of restraints or other forms of mistreatment based on their racial identities. So the nursing home administrators review the video cameras and confirm the residents and family concerns. The administrators initiated workshops on cultural competence, encouraging open discussion and awareness sessions. So they formed a DEI committee to address some of the biases. So these are the prompts in our discussions. Will these initiatives be effective at reducing bias among staff and nursing home residents? What would be some of the barriers and facilitators to reducing racial bias in this nursing home? And how can ongoing support and reinforcement be ensured to sustain a respectful workplace culture? And now we'll move into our breakout rooms. Thank you.
Thank you so much, Dr. Thompson. I'll move us into our breakout rooms, and we will come back at 4 o'clock Eastern time.